Doctors at Hani Baragwanath Hospital are raising funds, reportedly, to help sponsor the needs of unpaid medical interns. The Gauteng Department of Health, which is responsible for the payment of salaries, has not paid these interns, we understand, since the beginning of the year. For more on the situation, we're joined tonight by Dr. Sipho, Chief Director of Human Resource Development and Employee Health in the Gauteng Health Department. Sir, very good evening to you. Welcome to the program. So, as things stand, where are we with the payment of these interns? Have any of them received payment?
Good evening and good evening to the viewers. The situation at the moment is that all medical interns who have not yet been paid will be paid on Monday, and it will be full payment of what they have worked for until now.
Just explain to those of us who aren't aware of what happened why it is that 10 interns would not have been paid since the beginning of the year. I mean, a report I read earlier by Mia Lindeki was saying that one intern, in fact, said there had been a promise of payment around the 15th of January. We're now on the 5th of March and no money has come through.
So the reason why there is this late payment of salaries is that as Gauteng Department of Health, we depend on the National Department of Health to place or to allocate these interns in our hospitals. And we have a number of these hospitals that are accredited by the Health Professions Council. So usually these interns that are not paid are the additional interns that have been allocated in excess of our baseline 429 medical interns that we have a budget for and that we have planned for long in advance. It is very late during the year that we get these additional medical interns, not because of anything, but because we have the abundance of these hospitals in Gauteng. And once then these allocations for these additional interns are given, they have to go through 3 government departments, Department of Health, eGov, and Provincial Treasury, to start the processes of having to, ultimately appoint them and pay them. And these processes include the creation of posts, which we as Gauteng Department of Health must be given permission by Gauteng Provincial Treasury. And then once those posts have been created, after the Treasury satisfying themselves that we have the additional resources to appoint them for the 2 years, these then gives us an opportunity to create these posts, establish what we call mandates. These are appointment documents from the Gauteng Department of Health hospitals to a government department called eGov, that puts them on the payroll and the system, and ultimately they are actually paid by Treasury on the earliest run. Now, these processes usually happens in one department in other provinces. In Gauteng, these processes are spread between 3 government departments as a governance and accountability framework that is within those 3. And that takes some time under normal circumstances. But in this particular year, financial year of 2021-2022, where we had the 3rd and the 4th waves of the pandemic, there were additional medical interns intakes, and that put a strain on the system. But as we speak at the moment, all the 56 medical interns are going to be paid on Monday.
While I appreciate that, I'm sure you would appreciate that it's quite unacceptable, even given those processes, that someone who's an intern who'd been promised payment in January would still be sitting in the first week of March with no such salary paid. So desperate is the situation that some workers at Bara have now had to come together and chip in to help these students, these interns, get money for transport, in some cases even money for food.
Yes, I think that is really regrettable, and for any inconvenience that has been caused to these interns, really we regret that inconvenience. But as Gauteng Department of Health, we can only start the process of having to appoint them as and when they are placed with a full and a final budget, and there is that's cascade of processes. So I think that is what is our position at the moment. We have communicated with these interns before this media interview via their hospital management, so that then they can understand what actually have happened. And we have contingency plans to make sure that this thing does not happen in the future. And that is to just make sure that we agree with National that these allocations happens early in the year, and there should be a cutoff point beyond which we cannot take additional allocations, and that we are guaranteed of the payments, the budget to pay them, and to ensure that they are paid timeously in January.
Okay, so do you then, as the Gauteng Health Department, accept that the process which you've just outlined to deal with these issues, be it the placement of medical interns where there are numbers exceeding the posts, that the system that you have currently is broken and perhaps needs a complete overhaul to make it easier for you to respond quite quickly to the situation?
So what we are doing, we are advocating for a new policy position where we are guaranteed these placement early and the amount of money to pay the interns early. And we are also going to be engaging stakeholders, interested and affected parties, as in the interns themselves, organized labor and professional associations that are representing them, hospital management and senior clinicians who are training them, so that they can understand this whole system again. And of course, we will also improve our communication with them and with yourselves as media, so that the communities are also, we can account to the communities that we have to serve them through these medical interns. So those are the new changes that we will be able, hopefully in the future, to engage with yourself and tell you how we have improved the system.
Thank you very much for that. Dr. Sipho Sanabe, Chief Director of the Human Resources Section at the Gauteng Health Department.